Hello there. Good afternoon, good evening, good morning, wherever and whichever part of the world you are in right now. I know we're going through some tough crisis these days, and the COVID-19 is actually taking a big toll on everybody at this point in time. It takes a toll on our daily lives as well as on the economy, which is actually which is a much greater deal at this point in time. Today, I would like to do a small proposition on the COVID-19 quarantine app. My name is Shaju Matthew, and I work as a solution architect for marketing platforms and solutions. I work in the UK and based out of London, and I came up with this proposition so that people who are actually inventing quarantine apps in different parts of the world, they can actually leverage this model and then try to come up with a similar fashion, and so that they're able to curb the pandemic right at the very beginning. Unfortunately, we have actually gone too past because I could see the countries are actually struggling to combat this virus, especially the healthcare systems is compromised these days, so they are not able to address all the patients. Especially they are now given a choice to choose whom to save and whom to not, and that's a real bad situation that we are in right now. So without further ado, let's get in and see what this proposition is has to offer, and how we could leverage this, and to come up with a proper quarantine measures, and we're able to curb this pandemic. So before I start, I would like to take a few assumptions. I did view a few apps in countries like India, UK, and France, and as a matter of fact, even the UK. What I found is they don't have a strong analytics, or what they do have. I'm not too sure at this point in time, or they're not monitoring patients' symptoms and provide them with accurate, appropriate medical advice daily. So what they do is they ask few questions, basically the symptoms that they have, and then tell them whether they are basically a possible suspect of this coronavirus or not, and that's pretty much it. And then some apps even go to a level where they, once you give a symptom which is more likely to be a COVID-19 symptom, it puts an alert on the phone so that when somebody else comes close to you, it beeps saying that there's a COVID-19 suspect close by. I'm sure that person would really be in a bad state when something like that happens. But yeah, well, these are the apps that are currently available in the market, and in countries like India and France and Brazil are trying to push it to their own citizens to ensure that they're following the quarantine measures, and which is good. I mean, they're trying to do the best possible way. So, what today I'm proposing is a bit more to what that's already there, and this could be a good thing or not, but it's up to you to decide as to what exactly this whole solution looks like. So yeah, and COVID-19 infection for most people, this is a very good thing. So it only stays for maximum 2 to 3 weeks, as the immunity fights it out by then. So it is only those old and those with pre-existing diseases end up critical. That too not immediately, but from the seventh day or so. But I could hear cases that in different parts of the world, old people aged 90 and 70 are able to come out of this virus, I mean, successfully. So they're basically given the right medical advice at the right time. And that's when many people are not able to do it, because people are staying at home. They are being asked to stay at home, don't know whether they carry the virus or not. But and there are quarantine measures, but the quarantine measure also has a fallback because they don't know who carries the virus at this point in time. Nobody knows whether they have the virus or not. They just been staying at home. They call the hospital, or the I mean the go to the hospital at the last minute when they really can't breathe. So what through this app I'm trying to see set out a proper quarantine measure where people don't rush to the hospital to get tested, and we can reduce the spread by ensuring that these people stay at home always, so that we can turn the tide over, and so called flattening the curve in just 2 to 3 weeks. So, like, if you have 1 lakh people, or 100,000 people, or 1 million people having this virus today, in 2 to 3 weeks, if you're able to contain them in their homes, the third week you probably see 90% of those people coming out of this virus successfully. So, and the third week you just leave with say 10,000 or 1,000 patients. That's how it works. So, and this app hope to calm people down by sending personalized advices. So basically, you can see that when the pandemic such like these happens, you get fake news and you get demotivated. You don't know whether the government is helping. You don't know whether they're caring about you. But what we're trying to do is, the moment you give a symptom every day, you're able to get appropriate medical advice tailored to the symptom that you have at this point in time. So that's what we're trying to do. So they don't have to go to the hospital. So they're getting treated at their home through that app, which is basically the hospital goes to their home. So this way, the healthcare workers are also, not jeopardized in terms of the over workload. So they basically are able to focus and give more accurate, focused treatment. So that's basically the assumptions that I have for today. And this is a platform. You could see a lot of trending technologies at this point in time. They're the buzzwords right now: artificial intelligence, AI, machine learning, and data science. So, what do we have all these things in common? The common thing is data. So basically, without data, none of these technologies would work or probably come up with the fullest potential. And the more the accurate the data is, and more the accurate the predictions are. The artificial intelligence machine learning technology are used to actually predict the customer's symptoms, are able to give them appropriate advices, and let those agencies know which customers are critical, who are suspect, and who needs a testing at this point in time. All that thing can be done. And with help of data science, you can actually predict what is your future outcomes. Like, for example, how much of gears you need for the next week, how much of hospital beds you would be needing, and things like that. How many people are trying to fall sick, and what is the current trend, and what are the pattern, and things like that. So they're able to predict and analyze and come up with a possible solution well in advance, so that the NHS or the healthcare staffs are not overwhelmed, and they're able to the governments are able to acquire I mean acquire essential protective gears well in advance, so that they're able to cope up with whatever situation that comes in the future. So they basically are able to take well informed decisions. So this platform actually gives an option to actually leverage all these technologies. I'm not sure if there's more. Yeah, you can bring everything into this, because this platform can integrate with any other solution that is out there, which could actually give much more value for this particular proposition. Now, this solution can also integrate with the existing app which countries are actually promoting. So basically, all we do is we need to add an additional flavor where we actually record the symptoms every day, and then bring that data into this app, and then this solution, to ensure that we are able to come up with all these trending technologies, and come up with a more value and accurate treatment measures, so we are able to curb the mortality rate, ensure people are actually happy, and then come up with a proposition where we could actually eliminate this disease out of this country, or probably even out of the world. Um, so why do we need an app like this? With each passing day, this COVID-19 spreads like a wildfire and cripples everything around us. Um, the lockdown measures that we have, that the lockdown measures are there in every single country out there. I would say 90% of the countries are in lockdown at this moment in time. So what this does to the economy, it is going to be really chaos, and it's going to be serious problems if the lockdown continues again and again. And with the cases rising exponentially, the lockdown measures are also not really helping, because people have to come out and then go and take their daily needs in the grocery stores and things like that. So they're still coming out and spreading the virus. So we need to come out with a proper system where people are actually addressed in such a way that if somebody is found as a suspect, and they're treated in such a way that they don't have to come out of their home. So that's basically what I'm trying to achieve at. So healthcare systems like NHS here in the UK could be something different in your country. So they're facing the biggest challenge in centuries, and are unable to cope up with the rapid increase in COVID-19 cases. So this is really they're really overwhelmed at this point in time. And during the testing, and there's unavailability of adequate measures. When I say there is there's adequate testing equipment, there's no beds, there are no hospital. The call centers are not responding appropriately. They have to wait to a long queues, which basically left the citizens unattended at their homes. So I know a few cases here in my locality who actually had the COVID-19 symptoms, but when they called the NHS, they've been asked to stay at home. They never got tested, they never got treated, they basically just, it's basically they self-treat themselves. They had fever, so they had paracetamol. And if they had headache, they probably have something like ibuprofen to just to curb the pain down. So that's what they did. I mean, on the 10th day, they probably come out and they feel normal. They don't even know whether they have the virus now because they never tested. So there are cases like these which actually is going to now spread. Even though the countries are able to bring the curve down, there could be a second wave when the lockdowns are actually lifted off, because people, they don't know whether they have or not. They just go and spread the virus because there could be asymptomatic symptoms as well. Because recently we found some asymptomatic symptoms or asymptomatic patients basically, um, who are actually spreading the virus in China as well. So that's going to start to trigger a second wave, which is again not very good at this point in time. So currently, there are no tools available to know the actual impact of COVID-19, because you see what's happening is they're basically modeling based on the current test performs. They know exactly how much people would have contacted the disease. So basically, there's no actual measures. But what through this app, I'm trying to get to this actual core of it. Basically, I'm trying to get this to 98% accuracy, maybe I would say 90%, which is even good because we are able to get, the more closer we get to the actual count, the more better it is, because we are able to come out with accurate treatment measures. So yeah, by not knowing this actual count, it is actually posing a larger threat, because if there's a sudden outbreak tomorrow and the people are not geared for it, I mean the hospitals are not geared for it, and this could extend the lockdown period much further, making things far worse than what it is now. So with that, I just want to quickly go on to how COVID-19 quarantine app could help. So these are some of the bullet points that I've actually come out with. It's going to give you personalized attention, personalized communication advice via SMS, email, push notification. Basically, when somebody gives you a symptom or record a symptom, the app is going to be, it's kind of a chat bot, which basically it recognizes what you've typed. So basically it's going to analyze your symptoms and then gives you the appropriate medical advice. This is where your AI and machine learning comes into the picture, where we can do some calculated models. Based on symptoms, we can give the appropriate advice. So it's one trusted source of information provided by the government and the citizens. Basically, the current apps do this as well, and this basically ensure that there are no dupe or false information being spread out. So all citizens can just follow one single source of information, which is in the app at this point in time, so that they are not advised on incorrect measures, or not advised inappropriately. So there's an accurate estimation of potential COVID-19 cases with a location-based reporting. And when I say that, basically you will be able to know basically when people submit the symptoms on a daily basis, so you would know whether it's a flu or a COVID-19 case. So you can mark those people as suspects. So based on that, you'll be able to know the exact amount of measures. When I was saying 90% before, so that's exactly what I'm trying to come out here. So you'll be able to exactly measure as to how many people are affected with this virus in the country or in the county or in the council or in a particular town or a city. So that's how we were able to go, because with the location-based reporting, mobile app can actually send the lat and long values as well. So we also be able to know where the person is and whether he's in the move and whether he's staying in the same place or things like that. And helps the country to be prepared for the worst. As I said, once you know the exact cases that could come in, or when they're geared for the next foreseeable future, I mean, they can acquire the essentials and then take appropriate measures well in advance. And it reduces the spread of COVID-19 as patients who are not critical are tested and self-treated at home. Um, uh, uh, because what happens is only critical patients have to go to the hospital. I mean, they basically asked been asked to go to the hospital, because, and if they're not critical, they just have a mild symptom, they can still stay at home. They don't have to rush to the hospital themselves or rush to get tested. We know that there's a person like this non-critical case reported in this area. Now, since we follow the symptoms on a daily basis, we know when this person is going to fall sick. So probably on the seventh or eighth day, we can let the healthcare system know that this person needs a testing. So the healthcare system can actually communicate with the hospital's authorities that's close to the that person's location, or probably send a file to that hospital. So on a daily basis, said these are the people to be tested today. So these are the people who are basically mild symptoms who needed the testing. So these are the things that we can actually help to reduce the curve, because that person doesn't have to come out of his home to go to the hospital and get tested. So when the moment the people come out is when they spread. So we want to ensure that these people are actually kept at home, and they're given appropriate advices. Not they're not left alone, and we're giving the personalized touch by taking the hospital to his home rather than asking him to come to the hospital. So we can also reduce the mortality rate by doing this. We can actually bring down the mortality rate. When I say mortality rate, is basically nowadays people have to wait the last minute to go to the hospital, but here in this case, we would know when you would fall sick, because based on the patterns of symptoms that you're posting. So we would actually get that before you even call us. So that's basic idea that we are trying to do, that propose right now. So we know on the eighth day that you still have symptoms, then you would probably need a testing. On the ninth or tenth day you still have high symptoms, then what we need to do. So that's basically it's a call that the healthcare government, the healthcare or the NHS in the UK would decide and take a call on it, and then send an ambulance to that person's house and ask them to come and be admitted in the hospital. By doing that, they know things well in advance that who would be sick, so they can keep the relevant beds available, or probably bring another hospital close by, so that they can allocate these patients out, and so that they are able to get a focused treatment, and they're actually coming out of this pandemic, or getting rid of this virus. So yeah, this, as I said, so once you know what the amount of work, so you'll be probably great for it. So you know exactly what is going to come. So the healthcare workers can catch up and eradicate the disease altogether with more focused treatment procedures. So that's basically what the idea is all about. So basically, they know what to do, they know what is coming. Now they're well prepared for it. So if they need, they're short of staff, they can see how we can increase the staff, and they're able to plan it accordingly, so that they're able to not overwhelm their own work, and I mean with their own work, and and on doing so, they're able to give more focused treatments, and then they're probably that's going to bring down the mortality rate much higher. So we can see that the mortality rate in the UK is very way too high. So now they can bring that down. So, and this also not only reduces the mortality rate, but also, as I said, helps in assessing the demand of healthcare essentials like masks, PPE suits, ventilators. These are the big words these days. So if you want to get it from China or South Korea or Taiwan, you can actually put these orders in. I'm sure things don't happen overnight, right? So it's not like Amazon Prime. So they take some time for them to get it shipped back, and they fly it down to the UK with the current crisis in. I mean, every country is demanding a lot of stuff from these countries, and yeah, so you can probably predict and ensure that you're well equipped, well stocked with all these essentials, so that you're able to plunge exactly at the right point at the right time, so that we can get off this virus from this world. So last one is it's more the challenging one. So this is it's more of a standard. I mean, this is already available. Basically, the solution is already available. So you have the app already, and this marketing solution that I have right now is also there, and there's the analytics pieces there. You just have to put all these pieces together, and that's it. That basically we have all the most advanced technologies in there, and we just have to put them together to make sure that this actually works. In all the technologies work together in conjunction, and we are able to get the max out of all these technologies, and then win this battle against COVID-19. And so this is a solution approach. So we have this COVID-19 quarantine app, so which is basically in if NHS already has an app, basically, or if any country already has an app, they can use the existing app, and then they can plug in with the other technology that I'm going to talk about right now. So basically, this app would actually be a customer facing application. It's basically developed for patient assistance and symptom monitoring. It enables patients to report the symptoms, record the symptoms at any point of the day, and over a period of time until they feel normal and until they feel that they don't even have to put it again. And they can still even continue on because we're going to give them continued advice as to when they need to stop. Okay, and symptoms recorded in this app are sent to this marketing cloud with a geolocation, because marketing cloud is the core piece that we're going to talk about, which we're going to see in a small demo after the slide pack. And important communication like medical advices are sent as push notification to this app, so alongside the email communication. So and yeah, we could see that there's some more features about this app. So we will see that in the next slide. So that's basically a high level of what this app could do. So this could actually be whatever app that you currently have. This can actually these things are already there mostly. If they're not there, we can actually incorporate them in the existing app. So this is going to take less time. And Marketing Cloud is basically a solution which is only for marketing. These days, you have hospitals are built in just in a matter of days. You have football stadiums and big stadiums converted as hospitals. You have a B2B a commerce solution delivering a B2B B2C side. I mean deliveries, because they're B2B business to business. Now they're doing business to customer directly because of the lack of the demand of all these groceries and they need. And restaurants are doing food deliveries now, grocery deliveries. It's all changing. I mean that's a new normal for us now. Yeah, so we're trying to adapt. So what the same shoes I was thinking, what can be done in a quick uh, uh, turnaround, so that what existing solutions that we have, so that that can actually bring it all those technologies together and then come up with a better solution. So that's when I thought about this. Since I was already working in marketing cloud, I was actually overwhelmed or basically how this technology has evolved in such a good pace, so we could actually tailor this model to healthcare, so that we could use this for the fight against COVID-19. So this helps in sending personalized, automated personalized communication to users based on symptoms as they develop over a period of time. So today you'll have a message. If you have a fever, you will have been asked to take Panadol or paracetamol. Tomorrow, if you have some of the symptoms, you'll be advised accordingly, because there'll be a medical expert who actually sitting down and then looking at the symptoms, the patterns, and advise what medications to be given to what point of time to what customer. So we'll be able to tailor that. We'll see that in a minute in the demo that we're going to do right now. Critical value monitoring helps to determine those patients who need COVID-19 testing. So basically, we have some models like I've got the second point scoring models. Basically, it'll actually alert, or it'll brings out some critical values based on the values you've entered, basically the symptoms you've entered, and comes out whether you fall under the critical or non-critical bucket. And then if you're critical, what type of critical you are, whether you need to be sent to the hospital or you need a testing, all that can be measured here. And then the last part is you don't really need a mobile app. It could be an SMS or an email. So we can actually send location-based medical advices and recommendations. So we could tell the customer that you will be contacted from the closest hospital, which is close to his house, rather than putting him 100 miles away. So yeah, so these are the things that this application can already do. So I have just tailored that application in such a way that it can actually help in the fight against the COVID-19. So as I said, we should do this in 2 to 3 weeks. Yeah, there's something which we can come up with in 2 to 3 weeks. And SAP Analytics Cloud is basically the data science piece of it. So all this data that you put on the app and collected from different parts, from the managers and call centers and things like that. So all the probably different systems which you're going to connect to this application, and bring all this data in one place, and you can do some dashboard reporting, which you could actually monitor much better as to where what is happening, which city, which town, which council has the more number of cases. So we were able to relax the lockdown in those areas, and then make sure people are actually coming down to the normal life slowly, and also ensuring that we're climbing close watch on the people as to whether how the spread is going. And then in case if it is there's going to be a second wave, we can immediately come down with a lockdown. So we can do some lockdown on a focus on the strict measures on a particular area. So that's something which this app can also help, because we have a location based reporting. And yeah, so ability and monitor critical cases in real time, so you can see where the critical cases are, which town, which location has. Basically, once you get this data to a reporting tool, you can come up with any number of reports. So the reports can be generated on a timely basis as we go, because once you have the core solution of Marketing Cloud and the COVID-19 app, the data gets recorded in the system, and then that can be reported in any way you will, any fashion you would like to report it for, or to whom you want to report it to. If you want to report it to the government or the senior officials in the government, you can actually design a dashboard report with a boardroom, basically with a few reports with the location base, with colors and things like that, so they can quickly analyze as to how this app is doing, or how people, basically the citizens, are doing in this fight against COVID-19. So this is about the target architecture. It's pretty simple that I've gotten here, but it could get very complex. But it's very simple that I've actually done this way, so that you'll be able to understand what actually is happening in the background. And you have this COVID-19 mobile app. This could be any mobile app that's available, and that data, all we're going to do is we're going to extend to actually bring out these two features, which is symptom history and personalized advice and communications. And if you want to think a bit more, you can also give some reports and graphs whether the based on symptoms. You can see that your temperature is going down, which is good, and your cough is going down, and all that things can also be shown, so that it actually motivates the actual patient, so that he can stay strong, so that his immunity fights it much harder, so that it gets the COVID-19 off his body. So yeah, so you can see that COVID-19 mobile app, it's connected to basically a database at the backend, which all app has, and it also simultaneously pass all the information to the marketing cloud solution, which I was talking about. This omnichannel customer engagement platform. I'm using this omnichannel customer engagement into omnichannel patient engagement platform. That's the only difference that I've done here. It's got a customer 360. It can record symptom history. When I say campaign management, is basically these are the basic triggers which actually send the appropriate advices back to the customer. So basically, we are doing a campaign, and based on a symptom recorder, we are able to send uh, appropriate medical advice to this campaign. And then you're reporting analytics, and the key thing is segmentation and scoring models. This is where we are able to slice and dice which customer is a suspect, which customer is needs testing, which customer is basically uh, as cured, and all that things can be done in this tool here. And the last one is basically the SAP Analytics Cloud, which is basically the data science piece of it. So all this data goes to SAP Analytics Cloud. So all this can be viewed in real time. It's not that it takes time, some time to view it, because SAP Analytics Cloud will take the data directly from Marketing Cloud and view the report. I mean, show the reports. So it's real time. And also we have basically a service which actually sends SMS and email, another service to send the push notification to the app, and then but these services are basically, I've just got it here because this could be any services. So it is not that we need to only use these, but they just, it could be any services that are already even used right at this point in time. And the last part is bit is a call center. So we wherever it's appropriate need for them to be called, we can actually put them to a call center as well. So basically, these are the different channels we can contact the customer: push notification, cold calling, SMS, email, and if we need to have more communications, also possible at this point in time. But I guess this would actually do the magic for us at this point in time in our fight against COVID-19. So what are the features that we have in COVID-19 app? You'll feel personalized as users are actually staying at their home. They don't feel left out as as because they're frequently notified about their health conditions and what they do and what they're not to do and things like that. And this SOS feature could be there for any application, I mean, which is already there. At the time of emergency, the user can automatically alert the hospital authorities and pre-configured mobile numbers. We will be seeing as a demo today on this part as well. And it reduces the load on testing, as the critical patients and those who need to be tested are tested at their home. Like I said, an example, I know a person here. The mom and dad got sick. They never got tested. When they called the NHS, they said, "Stay at home. We will let you know." And they let you know has not happened until now. So because they're overwhelmed with the existing work, so they don't know whom to test and whom not to test. So this actually gives us a proper uh, a testing schedule as to whom to test and whom not to test. So the critical patients are always being tested and not left out. And the last one is geolocation. I'm sorry, not the last one. The geolocation also helps to track the user movements and help them check on them. So we know that the person's symptoms are actually reported not in the same place. If it is on different place, I mean, miles apart, so we'll be able to know actually whether the person is traveling or not. And the contact numbers, so yeah, it can display the correct numbers. I mean, close. I mean, I would say when I say correct numbers, the numbers which are appropriate for them, because he might stay in a town. He doesn't want to see the contact number which is in D or Z. He wants to see the contact number which is relevant to A. So all our things can be done. And the trustworthy knowledge base, yes, as I said, too much fake information around, floating around in social media. So, and which after reading you get sick by just looking at them. So you don't want to do that. You get a trustworthy knowledge base sent by the government to its citizens through this app, and it can be extended to food ordering as well. That's a cool part here. So once we are able to tie up with those big supermarkets like Asda, or could be Woolworths, or could be Walmart, could be Amazon Prime, or could be anything, Amazon Fresh, for example. So when you can bring all these parties together, so we were able to allocate our basically ensure that those critical patients who are falling critical don't have to even leave the home, because these patients can be focused and given personalized attention, even in terms of auto replenishment orders. When I say auto replenishment, so they can get the daily groceries over a week, every week. So it basically continues so that they don't even have to step out of the house. So they get everything delivered to their home. This is exactly what I'm trying to do. So we can with this app we know who are those persons who need this kind of a personalized care, so that they're not coming out and spreading the virus. So the moment they come out and then they touch some fruit and some stuff in the supermarket, they're spreading the virus. Yeah. So and someone else who is a healthy adult goes and touches the same fruit and consume the same fruit, though he washes his hands. And there are chances where he could miss out on some things. Yes, that's how the virus is spread at this point in time, unfortunately. But we can actually curb that as well using this feature. So let's with that we've I just wanted to I'm wrapping up with whatever I want to say. So we have we've seen the need for it. We have see how it could help, and then the solution approach, the architecture, and the features. Now we're going to see a small demo as to how this actually works. All right, with that, we come to the demo scenario. So I've taken two patients here. On my left is Kin Ko, and my right is Marley Loington. And they're basically, you can see the demographics information here. It's basically they have the symptoms and they started using this quarantine app. And we will see how this app behaves differently for these two people. And they're going to use a common actions like record symptom, food delivery, and SOS call. If you see on the left hand side, for Kin Ko, she's 50 years old and she's a female, and the symptom she's on the 8th day getting the symptoms. I mean, she's been recording for the 8th day, and there could be people they would have missed out to enter in the first few days. They could have started with the number of day one as I mean day 8 as day one, but we still be able to track those symptoms. Yeah, so it's not something which we're not able to track. So it's basically based on the symptoms you're able to give the right advice. So in this case, the status which says falling critical is not something with user input. Is basically the calculated model, as I was talking about AI and machine learning. So you're able to bring some modeling here, and then based on the conditions and pre-existing disease in the country visited, we were able to arrive at the status here. So she could be a suspect or a potential suspect for COVID-19, who needs attention and immediate care. You can look at a pre-existing disease on the left-hand side. She has cancer. She reported that she has cancer. She has hypertension, and to top it off, she also visited Italy in December 2019, and Germany in January this year. So basically, there's all these things, proves the fact that she is a critical patient, and she might be very sick with this virus, and we need to get her to the hospital right away. So these are the things, indications that we would be able to let customers know, I mean patients know, or basically bring to the patients through this app, so that we are able to combat and fight this virus out of this world. And on the left hand side, you see Marley Longin is actually age 56. He's male and he's on a symptom day 2, and he's gonna say this is normal because he's only experiencing mild symptoms, so he doesn't need attention at this point in time. So this is how I'm able to segregate patients who need attention, who do not need attention. But I know that Marley is going to become sick in the future, so I can be prepared for Marley in the future, probably next week or so. So this is how I'm able to assess who needs help, when, and how, and how better we could help with the focused treatment, so we can bring the mortality rate down, as well as the spread also down, so we don't have to ask the people to come to the hospital, rather the hospital comes to their home. So that's exactly how we're going to do. So let's see how these symptoms are being sorry, these actions are being performed in the app, so we can see how it actually works. Okay, so let's get into the demo. I've got two apps, one for Marley Loington, and one for Finco. So let me put it on the side of either side. Okay, so I've already done the registration bit a long time, so that I don't want to take your time. So I'm going to get started in both the app. Okay, so what they're going to do is they're going to record today's symptom. Yeah, I'm just going to click on record symptom, and record symptom on both the sides. There you go. I got the symptom questions that I've got. So basically, um, I just have to record these symptoms, and I'm just gonna say these are the symptoms that I need. I've got my temperature is like say 39. I would say 39.99. Um, how long I can hold my breath? So basically, I can only hold for like 4 seconds. Do I have sore throat? Yes, I've got critical. What type of cough you have? I've got dry cough, which is more like the symptoms of COVID-19. And what else do I have here? Okay, do I have headache? I have a mild headache. And then do a body ache of critical. Sure. Now since these actually mild symptoms, I would say like 35.99. I mean, he doesn't have anything acute here. I might have to say this. Difficulty in breathing is critical, which is one of the key things. So here he doesn't say there's nothing there for him. He can hold the breath for 40 seconds, which is good. And does he have sore throat? He has mild sore throat, which could be a potential suspect in the future. So he's got mild cough. He has no headache. He has no body ache as well. So I'm going to submit his symptoms. I just have to type a cough. Cannot tell. I've submitted his symptoms, and let me submit her symptoms as well. Alright, so I've submitted both the symptoms right now. You can see that the symptoms are recorded successfully, so click OK. Alright, so now I'll go back to the app and just to see what has happened. So I'm going to go to Finco's account first. She's a critical patient. So let's see what has happened right now. You can see that she has recorded symptoms for the 8th day. So you can see that she's recorded a symptom for the 8th day. So you can see that she's been recording symptoms since the day 2. From day 1. So you can see the complete the patient journey here. So you can see that she has installed the mobile app. She is she's actually recorded first symptom, and she's actually come out with second symptom, and we've sent a message. If you want to see what the message we send, you can just click on it, and you'll be able to see the message as well. So if you click on it, it tells you stay indoors and stay motivated. You're doing great. Keep monitoring your temperature and record symptoms directly. So this is something which we send for non-critical patient. Now she has become critical, so we would have sent her a critical message. You can see that symptom is critical, so you can see that before we used to send a non-critical message. So now we are sending a critical message here. So if you see the critical message, basically it tells NHS staff will contact you next 24 hours at your home. You'll be tested for COVID-19, and depending on the health condition, you'll be admitted in the hospital for further treatment. Yeah. So some doctor is going to visit her soon. So which is actually a good sign of motivation, because somebody is going to come to her. She doesn't have to call the hospital. The hospital calls her. So that's how it works. So let's see what has actually happened right now. I've received notifications right now, and let me go back and show you. This is the notification for kin. Uh, so this is a notification for kin. I've actually clicked multiple times, so it's okay. Just appearing multiple times, but that can be controlled in the development. So you can see that your medical advice for today's symptoms. She clicks on it, and she gets her medical advice for day 8. Now here for Marlowe, he's also getting a medical advice for day 2. So you can see that for day 2, he's getting this morning. So you see that this the information is completely different to both these people. Yeah. So that's how we are able to track and send different messages based on the medical symptoms. I mean, I would say not messages as such, medical advices based on their symptoms to appropriate individuals accordingly. So that's how I'm able to track the customer. By doing that, I'm also able to track the customer as well as to when we would fall sick and when he needs attention. So I will go back. Okay, let's see how this is actually done. It's done. So I'm just going to go back to the patient history here. So I'm going to Kinko's patient history first. So she's a critical patient. So you can see that she's already marked as a suspect, and the current status is potential positive. So basically, how we came to this particular status is that you're able to know that she's got cancer, she's got hypertension, and you can see that she's actually given critical values for everything. So, and then she's also visited Italy and Germany in the recent past. So with this with these information or data, the system, the AI or machine learning system, is able to predict that this customer is a possible suspect and he needs attention and immediate care. And that's how we're able to tailor the ads accordingly. I mean, not ads, medical advices. Ideally, it is ads, but in this case, it is medical advices. So if we look at Marley's information, so Marley's it seems to be okay. You probably would have got this virus contacted from another patient, and we still not got enough data for us to tell whether he's carrying the virus or not. So maybe during the course of time when he has critical breathing difficulty, or it could be where he's really falling sick, we can see based on these information here, we'll be able to assess whether this patient is also falling sick or not. But for now, he is normal, so we're giving him the right advice at this point in time, and then we can also ensure that we're also delivering food to him as well, so that he stays at home. So these are some things which we can do. And if the symptoms that we have recorded here is basically for demo sake, but this could be the actual symptoms with the doctors and what they advise for us to record as everyday symptom, for us to give for the doctors to actually measure and come up with appropriate assumption that this particular person would be or could be a suspect for COVID-19. So that's how it works. If you look at the way how we did it, this is a symptom record. This is a campaign. As I said, the campaign sends the messages. So you can see that the campaign is being sent here, and then the trigger is symptom record. So every time when somebody submits a symptom, when I say every time, it could be even multiple times in a day. As you can see in this case, I've actually put it multiple times. So every time I put in the symptom, I will get that based on the symptom data, I would get a different messages. So she said she got. I've actually submitted multiple times by accidentally, so that's why she's getting multiple times. So I could just ignore that for now. So if there is a change, the data would change. The notification will also change. If there is no change, obviously, the same message is going to be sent back. So you can see that We've got three buckets here. The first bucket is basically let me just go from the bottom. The first bucket is to send the send a non-critical message. So you can see that I've filtered with non-critical message here. Let me just refresh this a second. Yeah, this is send a non-critical message for all these people who are people with non-critical stage. They'll be getting this message, and this is a critical message. And people with with more accurate symptoms or more prone to the falling critical, they will get a critical message. So that's why you see that the messages are different for these two people. So you can see that if you go back to notifications, you can see the advice is different, totally different to these people. And then we can also do one more thing is we can actually create a phone call record. So what's going to happen is we will be creating a phone call for all those critical patients. So we can see that we have done a filter criteria called C19 patients. I'll come to this, how I created this. So if you look at the other ones, we'll see that this is C19 because these two buckets are basically for critical patients. The last bucket is basically non-suspects. So you can see the filter is non-suspects. So I will also show you how I created this filter. So basically, this is how I'm able to target or tailor the advices accordingly. So this could be more complex when we actually go to the real ground scenario. You will have multiple buckets here because we can categorize people accordingly. You can also categorize people based on what they have. Like if they have cough, you can advise them to have something called cough syrup. Like in this case, he has got cough. So we have asked him to use bronchostop for cough. So this could be different in different countries. So yeah, you can actually tailor your messages accordingly. So this is it's practically simple. There's not much development here. It's already available in the solution. So all I did is just to plug in the patient symptom history part, and then I'm running this the solution on top of it. So the next example, we've seen the recording symptom part. Now the next example would be to check for SOS call and food delivery. So let's go and check for the food delivery part. So let me go back to the food delivery. So I can actually, basically how you want to lay this thing. So I've actually laid it this way. So you could be different, more. The app could be more user friendly. So in this case, what I've done is I've clicked on SOS intimation for Kinko, and let me do the same thing here as well. I'll do the SOS intimation for Malo as well. Let's see what's going to happen. Yeah. So in this case, I've done something different. Let me go and see. Let's go and see how we have done it. So what we've done is in the SOS intimation call. So basically, we're also following on this trigger for somebody sending an SOS message or intimation. So what we've done is we are going to send a push notification for both the people, for suspects and non-suspects. So first one is, let's go for the suspects first. So what we're going to do for suspects is, you can see the filter criteria is suspects. We're going to send a push notification, and we're going to say that please stay calm, help is on the way. And then we're going to export them into a file, and we're going to and for this non-suspects, we want to ensure that this call is genuine. So we want to ensure that or it could be an accidental. So what we're going to do is we're going to ask the call center to call these people to verify before they send an ambulance. So that's going to call center, and then we're going to send a push notification, so saying that you will be contacted by NHS medical team soon. So for the suspect case, there's no question asked. They will be sent an ambulance soon. So that's what this goes to the straight suspect here. So you can see that we don't go for a call or something. The bare minimum, they would get a call from the ambulance driver just to confirm that that the call is genuine. So that's how this works. So let's quickly wait for the message to be received on the app. So I think I just got a mess sound that I think I received a message in one of the apps. So let's go and see what she's. Yeah, so it says please stay calm, help is on the way, and then the team would be contacted. So you can see that this is a message that we received for Finn. Let's see what the message. Actually, I've clicked this accidentally multiple times, so you can see that you'll be contacted by a medical team soon on Marley screen. So see that completely different messages being sent to different people here. So based on the symptoms that they have. So that's how it works. So let's ignore this for now. Okay, let me refresh this. And you can see that I've also created an export file. So I can transfer this data to a hospital authority, or it could be to any authority who needs this, who needs to take care of this particular patient. So you can see that all the critical information have been sent to this customer. It can be more, it can be less. It's how you configure. So you can see that the first name, last name, and the phone number to be contacted. If you have other information, also it will be transferred as well. So, and this is something which we can send it to any third party or any agency which actually takes care of the SOS calls and SOS intimations. And this most probably will be the NHS hospitals. Yeah. So that's how we are able to send the information across. So you can see that you don't have the information of you only have Kim's information because she's critical. You don't have the information of Marlowe here because he's not critical, and that's something which we need to consider as to who needs to be in this file that's to be sent to the authorities. So we can actually play around with this because, as I said, this solution is completely customizable. I mean, as an end user, you can actually play around with whatever exactly is the messages we send, who needs to be in the file, and to be sent to whom, and things like that. So on top of that, we can also see the performance of these things. Just refresh, you can see. So there's basically I've sent 5 messages and all the fives are delivered actually. So that's something which are a small analytics you can see. So let me go back and come back with the final scenario, which is the food delivery. The food delivery works similar to it. Um, so let me go back here and then go to user request, and I'll do the same here. User request, and I'm going to ask for food delivery. Yeah, food delivery, and I click on food delivery. So you can see that there are different options here um, uh, in the user request: SOS intimation, hospital admission request, COVID-19 test. So basically, you can actually use more triggers, like I need hospital admission. So when I click on hospital admission, you will be again assessed based on your criticality and your current status, and then you'll be as advised. So these are some things which a user can trigger himself. There's something which I've come up with, but generally speaking, the hospital authorities will automatically be able to reach customer if they fall critical based on the symptoms that they've entered. This is an additional thing that they can still request from hospital based on the symptom. They will be advised accordingly. We can send a message saying that you're not falling critical yet. We will contact you or something like that. We will contact you soon or something like that. Yeah. All right. So we have received the food delivery notification right now. So let's see what happens. What Marley has got today. So he's not a critical patient. So he's saying, "We are sorry. Please try again later, dear Marley. We are sorry to that we are not able to, accept your request now because I know Marley is not a critical patient. So, well, it depends. If you have the slots available, if the agency can deliver, then we can give them a different message. Yeah. So now in this case here, she's a critical patient. So, and we're getting a message saying that her food delivery is accepted. So that's how we're able to record different uh, different messages. I mean, basically send different messages based on their current symptoms or current status, and who needs to be addressed or not to be addressed. So this system actually provides a way to automatically focus on people who's actually critical and is falling ill, and automatically on who are basically it's on people we are leaving out the rest. We're still communicating to them, and we're telling the reason why we are not able to provide with them. We probably can tell them because since we are only focusing on the current patients which are more critical, For now, we can't accept your request, and people probably we might do it later when the slots becomes available and things like that. Yeah. So if the slot's available, you can actually basically anybody who's recording the symptoms can, because this is also another feature. Like if somebody start recording symptoms in the app, which means that they are basically prone to carry the virus, and you want to ensure that these people stay at home. So this can be based on the availability and the current schedule. You can actually um, ensure the food delivery is sent to everybody. So basically, what happens at the back end is, again, similar to the SOS call, we will be able to create a file, the export file, and this export file will contain in this case, it is only Finn who is actually part of, is a critical patient. So only Finn's informations are being sent to the agency for food delivery. So that's this could be a flyer, this could be a direct transfer to an agency if I have one. It could be in any way, in any format possible as well. So and similarly, you'll also can make a food delivery call, so that once this information is sent, you can also send, if a call center team, they can call the customer and then ask them what are the things that they need as essentials, so they can record and they can create an auto replenishment order on behalf of the customer, uh, by the for the I mean, we have the customer in the apps, like in Asda or in any supermarket portal, especially for those people who are going to. I mean, these. That's how I said in the initial, when supermarkets work with the government, they can probably allocate some delivery slots for these critical peoples, and those critical peoples can be keyed in by the call center agent. So the call center agents call these customers and keys in those information. So whatever they need, it's a daily replenishment. So they create an auto replenishment order. So they are actually getting the groceries that they need for the next 3 or 4 weeks or 5 weeks. It depends on how long they need. So that's how it works. So that's pretty much what I would like to show as to how we are able to segregate the app behavior based on the customer's current status. I mean, the patient's current status. So we saw that when we record a symptom, when we ask for food delivery, when we create an SOS call, what happened? Basically, that's how we are able to classify the customers and send them tailored medical advices, tailored notifications, and provide a much more focused treatment. Yeah. So more on that on the analytics side, I'll just quickly show you the segmentation part as well. So let me go to the segmentation. So the segmentation is a very powerful tool. So you can actually create your own model and then create your own buckets. So I'm going to all patients. Basically, this is where I've got a data model of all the patients. So I'll just quickly show you the data model that I have here. I've got the patient's contact info like ID, origin, sex, age, and house number, the contact information, and their lat and long information as well. I'll come back to that. And your patient's current status here, these are basically calculated fields. The number of household, testing performed, testing results, doctor comments if there's any, and then and you have symptom history. This basically is what they do it every day, record their symptoms, and their pre-existing diseases if they have any, and their travel history to any countries in the past, and they calculate the attributes. And basically these are the basically based on the date of birth, we were able to calculate the age, and this is basically a simple attribute calculation, but there could be multiple complex ones as well, like the COVID-19 suspect. So this is how I was able to determine who's a suspect, who's not a suspect. So I've got this bucket here. So this is a COVID-19 suspect, and this is not a suspect. So he's not a suspect, and it is a suspect. So that's how. So this is what I've used it in my campaigns. I mean, to send notifications. If you see that I've got that suspects, and then this one will be the non-suspect. Yeah, so that's how. This is where exactly I've used here non-suspect and suspect. So going back to segmentation again, you have all the activities that they perform. So if you click on the type, you can see all the activities that they perform, like SOS call, food need, email outbound, lots of things. Whatever has been recorded. They when they view a notification, even that is recorded. So so basically every action of the patient is recorded. So we use this action to actually appropriately address the customer needs. So coming back to the location-based reporting, so if I click on the longitude, this basically is a geospatial segmentation attribute. So basically we can segment customers based on the geography. So click on show clustering. I've only taken an example for the UK. So you can see that the cases in the UK are shown here. Okay, so you can see that I can zoom in. This could also be sent as a report with a much better, good looking view, but this is just a segmentation for us to put customers in a different bucket. So let me just quickly do some small segmentation here. So how I actually do my bucketing is basically, say if I wanted to, cover this area here, like say draw polygon, I click on draw polygon, and then I just select this area. I want to cover the city of London, yeah. So I just select the bucket here and then click on complete polygon and then keep. So basically I've got how many customers here? I'm sorry, patients here. I've got 163 patients, and I want to see all those people who are critical, yeah, who are suspect, COVID-19 suspect. I've got 70 of them in COVID-19 suspect. So if I want to see where these 70 customers are, I can go back to again to the longitude here by selecting the last node. Go back to longitude here, and I can find the suspects are in this area. So basically, I've got someone close to Covent Garden, and then someone close to the Piccadilly Circus and things like that. So basically, Monument there are 11, and here in Victoria they've got 16 cases. So basically, I can segment customers accordingly, and then I can basically draw a polygon across across the UK and then segment in different buckets. This is just one example. Basically, there could be multiple examples. So I can find all these suspects with high cough or breathing difficulty. I can just quickly go and check. There are people with the 30 with mild breathing difficulty, and then 10 with who are nil, the 67 who are nil, and the 3 with mild breathing difficulty. So people with nausea, people with short cough, total temperature. You can see the temperature readings of all the space, so I can basically drag and drop and then do a temperature reading between so and so. So I can do it between, say, 36 and so for example 40. So I can get all those people who are between those ranges. 18 people who are within that range as well. So basically, I can I've got this tool, I've got this data, and I can do slice and dicing, and then come up with my own buckets. So when I say buckets, is basically it's how I target people in this bucket. So if you ask me how I'm sending personalized messaging, is based on these buckets. So I can, if I go back to the symptom campaign that we've done, uh, just a second, let me go back to the campaign. This is a symptom record campaign, right? So I can have multiple flows here. So basically, I've just only shown you 2 different messages, but there could be many number of messages based on the doctor's advice. So there could be different messages for different symptoms. So we can actually, make it more complex and create more buckets, and then fit them accordingly. So when people automatically fall in that bucket based on the symptoms on a daily basis, they get the appropriate messages. So that's how we're able to send this tailored message across the patient across the country. So that's exactly what I would like to show. I could just quickly show you how powerful the tool is. So the only complex part that I built was on this patient history as a this is exactly what I just built. It's apart from that, it's all out of the box, so you can quickly deliver the solution to the market, so that to the country, so that you're able to track the symptoms more appropriately, send tailored advices, and ensure the NHS staffs are geared well advanced, and they're able to do the focused treatments across the country, and in the event of which we are able to fight this battle and come out successfully against COVID-19. So that's exactly what I want to show as a demo today. So going back to a slide, The last slide that I need to show is basically what are the things that you need to do in case if you're going to go forward. So if you have an app, which is very good, because you have to bring the app up to space with this current features that I've just shown you. And then we need to have this marketing tool. This could be SAP marketing, it could be any marketing tool that can do this kind of featuring. And then yeah, and since data volume could be used, we'll be probably looking at a private solution, a private cloud solution. It could be a cloud solution, it could be on-premise, but whatever it is, it could be of adequate size, and it has the enough processing power and the RAM size to actually withstand the complexities and the volume of data that we want to actually work on. And we need to actually this is basically a proposition, so we need to brainstorm the solution a little further to actually connect the dots, like the food delivery and the hospital connectivities and things like that. And then we need to identify the foundation of this app and bring out as a first release. So basically that's the core part. We need to identify what are the foundation. Once we do the foundation, and then we can top it off with multiple releases, and then release more features day in and day out, or like on every week. Like for example, first week we deliver with SOS, and second week deliver with a food notification, food delivery as well. So likewise, we can keep on adding things to the app, and then we can also work with the app solution provider to actually work with the government so that they're always with them throughout this crisis. To ensure that they're able to give the IT advice or the solution or the fixes that they need and the support that they need in terms of running this application. And the last but not the least is actually spreading the word. So we need to actually ensure that the app is successful. You're spreading the word in your daily briefings, your in all the marketing channels possible, in TV, newspaper, YouTube, Facebook, Instagram, SMS. I can see that it's already being done, because I could see the NHS message, okay, below Google. I could see it in Facebook. I could see it in YouTube. So basically, that could be this app advertisement where they click on it and take them directly to an app store or Play Store where they can download the app and then install it and then use it. So with that being said, this is exactly what I want to show in this demo. I mean, in this as a part of this proposition and the demo, and I hope we are successful in taking this pandemic off this world and get back to our normal lives as soon as possible. I wish you all stay safe and stay blessed, and let's fight it together and put an end to this pandemic. So I hope this proposition is useful for you and was good. And if it's good, then try just take it forward. And if you need any help, you can always contact me. I'll leave my details right below in this YouTube channel, so you can contact me as well. And thank you for your time, and stay safe, and God bless. Thank you. Bye bye.